That's why we said, well, if you want to get at this, we ought to quit chasing the symptoms and look at the root cause. And the root cause is that so many people in this country don't have any form of insurance or payment. You got this artifact of the early 20th century that we decided we would have employer-based health insurance, and then that really kind of came out of the Second World War.
Yeah,
when we
really the
wage controls.
Middle of 20th century.
Right, middle of 20th century. Then in the 60s, we said, well, there's some vulnerable groups who aren't being cared for by employers and probably will never be cared for by employers, and that's the very poor who probably don't work, and the retired. So we had Medicare and Medicaid, Medicare for the elderly, Medicaid for the very poor. Well, now we've got 60% of our population covered by employers and 25% covered by our government, and 15% are in the middle and aren't covered. All the while, the cost of health care because of technology and all other things has just kept escalating. So now we're at a point it's very difficult to find a way to absorb those costs for the uninsured. And I tell lay groups frequently, when you ask a hospital what their payer mix looks like, most of the average hospital in the state probably does 65% of its business in Medicare and Medicaid. 65% of its patients with Medicare and Medicaid. And Medicare and Medicaid pay under the cost of caring for that against your costs. Then you've got 15% of our population who are uninsured, and they pay far less even than governmental payers. So now you're at 80% of your business, and you've lost money on it. What are you going to charge on the last 20% of your business to try to break even or make a single-digit positive return? That's why hospitals' charges are so out of whack. And the average in the country is 250% of cost, what hospitals are going to charge to try to recoup what they've lost on Medicare and Medicaid. All of that factored in. One of the things we can't control is what Medicare pays. It's a federal issue. We decided
to go back, when you say
sure, Brad.
Charging 250% of cost to make up for Medicare and Medicaid, isn't a large chunk of that be completely uncovered?
It is.
Okay.
But I think when you look at the fact that 65% of the book of business is Medicare and Medicaid, a lot of people, Ed Sellers, Robbie Kerr, and others would tell you that you could cover all the uninsured, and you still have a big problem because 65% of your business is coming in under cost, maybe 90% of your cost. You got to get that back somewhere. Said another way, it would probably do more to ease the problem of cost shifting if we had Medicare and Medicaid pay 100% of the cost for their beneficiaries than it would to cover the 15% who are uninsured. But that's a big bite. It's a lot of money in this country. We're talking about growing the Medicare and Medicaid budgets substantially. So it's a challenge. Our group, our hospital said, well, we want to work on this issue. And our advice to them was, we're wasting our time if we're going to fight the doctors or fight Blue Cross or fight the state chamber. If we can't do something collectively, it's just not really worth spending so much energy on it. So we sat down about a year ago with all those groups, and we asked the governor if Robbie Kerr could join us as a resource. And he said that was fine. And the group felt like it is a problem for all of our industries, and somebody needs to take some leadership. And despite the best efforts of some of our elected officials, they don't understand it well enough to try to design a solution. But the industry itself needs to provide leadership and give ideas. So that's where the Covering Carolina group came from.